source by far is when there's a hearing loss. When the hearing drops out, the part of the ear that we talked about, the cochlea, that translates the sound wave into nerve language, the piece of that cochlea that just drops out, for whatever reason, starts to unleash the same message to the brain as if there's sound going there. And that's the theory where tinnitus comes from. It is, to me, it's almost like phantom pain. If you amputated someone's leg, they can still feel their foot, even though there's no foot, because those nerves are still sending messages up. It's almost like that part of the ear, the cochlea, has been amputated because it doesn't work anymore. It either got old or got damaged by a loud noise, but it's still sending a message to the brain, and that's where the most come from. Sometimes tinnitus can come just from grinding the teeth. If the jaw joint, the TMJ, right here, where the roof of the jaw joint is the floor of the ear. If that area is irritated, some people will come in and they get a lot of ear symptoms, not just ringing, fullness in the ear, pain, dizziness, so that can masquerade as an ear problem. Sometimes their pulsatile tinnitus, I mentioned, can be vascular things like an aneurysm or whatever. So when someone comes in with pulsing tinnitus, we always look to make sure there's not a vascular thing. There's not much you can do about it. If it's pure tone tinnitus, because I know that was your next question, if it's pure tone tinnitus, you can sometimes mask it out. They have these devices you put in the ear that tries to find the exact tone, and you can mask out the sound. Most people with it, they get used to it. Some people say it goes away. I think they just got so used to it. Biofeedback's been tried. All these things they talk about on the radio, they don't work. Ginkgo and lipoflavonoid. I think it's kind of like snake oil. What else? Yes?
Best way of cleaning your ear.
Q-tips out here, there's no great way, just because of the way the ear is structured. You know, as patients come in and they tell me they're using Q-tips, I'm sitting there 5, 10 minutes really working, staring right at it through a magnifier. I said, look, if I'm looking right at this and I'm taking this much time to do it, how can you just blindly go in there and do this? So there's no great way, and there's no reason why you need to. If you feel your ear is getting stuffy, just go in and have a doctor clean it out once a year, twice a year.
All right, squirting warm water in there.
You can make yourself dizzy doing that, but it's just a temporary thing. They came out with a device which I thought had some merit, which did just that. It was a thing that you stuck into your ear, and when you squirted it, it actually squirted water this way. So it tried to push things out. Peroxide, all that it does is it's the mechanical bubbling of the peroxide. It might loosen some new pieces of wax. But once you get a big block in there, there's no way you're going to get it out. And patients will come in frequently and they'll be like, oh, I've been using Q-tips. I don't know why my ears, you know, I shouldn't be dirty. And I pull out these gigantic things and they like almost faint in my office seeing how big they are. I say, you're getting the tip of the iceberg with the Q-tip. You're really not getting most of it. What other questions?
Well, first, I want to thank you for the talk, which was outstanding and really wonderful. And since you did such a good job, I'm going to give you a chance to tee off on a primary care doctor, and you can maybe tell us what are the problems that you see coming to your office that are, say, most often misdiagnosed by primary care doctors, or maybe treated ineffectually, or not worked out properly?
By any primary doctor, or you?
Let's look at personal. So we'll say on average.
You know, that's not an easy question to answer. I think dizziness in general, and it's not because it's just such a difficult thing for anyone to diagnose. And you know, after you rule out stroke, the patients go to the ER because they're dizzy, and they call 911. They get taken in. They do a CAT scan to make sure they haven't had an intracranial bleed. They haven't had a stroke. They do a cardiogram to make sure they're not having any arrhythmia. They check the blood work. They make sure the blood pressure is okay, and then they say, okay, you have vertigo. Well, it's basically like saying, you're going because my temperature's up, and you're leaving until you have a fever. It's because they don't know, but it's not their fault. Their job is just to rule out certain things. And I think part of our system in medicine in our country, it used to be the GP, which they knew everything. They were maybe not experts at anything, but they were jacks of all trade. Now we've become so specialized, even primary care is in a funny way so specialized that everyone has their little thing. You go to an ear doctor, he's looking for an ear answer for dizziness. You go to the cardiologist, he's looking for the heart answer to do it. So I think it's a fault of the system. So it's not that someone sends a patient to me and I'm like, oh, they misdiagnosed this. I think everyone plays their part in trying to come up with a diagnosis. I think dizziness and headaches, I think, are the two hardest things in our specialty because we can't see them. Patients come in, they can come from so many different things.
That was a very kind answer.
I practiced. Had you seen my video? Yes.
Well, tomorrow I'll probably ride my bike up to Pennsylvania, and after we get something to eat and we get on the bike to ride back, I'm dizzy. I mean, I can still ride the bike, but I have this feeling that the world is spinning or moving or something.
After you're done.
Yeah, no, when I ride for 9 miles, I get something to eat. It seems to happen after I eat. And I'll get back on the bike, or sometimes I'll just get up from the table, and I'll be dizzy. I can still ride the bike because I can see what the orientation is. It just doesn't feel right.
Where's your accent from?
What?
Where's your accent from?
Chicago.
Chicago. I was going to guess that. I don't think that's ear. If I had to, right off the cuff, guess where that's coming from, when you eat, I remember when I was in medical school, the worst lectures are the ones right after lunch, because you eat. Now your body has to digest all that food. All the blood vessels to your gut dilate to try to get more blood to your gut. Well, that's stealing blood from your brain, so we'd always be so tired right after that. After you eat, there's kind of like this big watershed of blood that goes to try to digest all that. Perhaps you're getting dizzy or lightheaded because you're just not getting as much circulation to the brain at that time. That'd be the first thing I would think. I don't think it would be the ear.
We don't eat much. I mean, it's like something
Yeah,
like
but I don't think it's the ear, because the ear, if it were off, if anything, it's almost like doing vestibular balance rehabilitation, just riding the bike, just to get used to riding it. So I don't think that's coming from the ear. I'd call Kevin, not the ear.
It's always a good call.
Question. If a patient comes to the primary doctor and complain dizziness, should I refer the patient go to the neurology or go to the ENT doctor?
Well, I think you have to look at it and say, here's this category of dizziness. It can come from many things. The first thing they go to the primary care doctor to rule out heart, rule out stroke, rule out all things that are general in that regard. And then a judgment call has to be made. Is this coming from something peripheral? Remember, the brain gets input from 3 areas to try to orient itself as to what's up and down. One is what we just talked about, the ear mechanism. Another one is vision. Your brain knows what's up and what's down. And the other one's gravity. You can tell when you're doing this. That's why people, when they're on a boat, gravity's kind of thrown off. You kind of really feel, you can notice that when you have one of those input of data is not there. So I think a judgment call has to be made by the primary care. Is this something that's coming from poor data going into the brain? Something with the vision? Could be. A lot of kids will come in dizzy. It's because they need glasses and they've never been to the ophthalmologist. Could it be the ear? Or is it some neurologic thing that they just can't sense, like a neuropathy, or it could be a neuropathy, they're diabetic, and their sensation of where gravity is just not there. If it's not data input going into the brain from the ear, the eye, or gravity, it could be something in the brain itself. It's just, it's like a processing problem. The cerebellum, the part of the brain that controls balance. Someone could have had a stroke, someone could have had something like MS can cause it. MS, 10% of patients with MS present with multiple sclerosis present with dizziness. 30% of patients eventually develop it. So there are a lot of things that, the list is, I'm not kidding when I show you that list, that stack of books. There are a lot of things that can make you dizzy. What other questions?
Seasickness, is that the inner ear?
Most of the time, again, your brain gets information from those 3 centers, from the ear, from vision, balance, from gravity. When you're on the boat, the gravity thing is kind of thrown off because you're doing this. Your brain does okay when it has 2 of the 3. You can kind of compensate. But then when you're on that boat, things are moving like this, your vision is not exactly. That's why everyone always says stare at the horizon. The whole concept behind that, at least if that's stable, and your brain knows it's stable, maybe you'll get some kind of visual input that may make it better. It doesn't work really well. I can tell you anecdotally, we were in Naples, Florida years ago, before you were born, Alan. And we went out on this fishing boat, my wife and I, and even had signs of, if you have balance problems, don't come out here. The water was so bad. And we were saying, I don't have problems. We went out, and I saw some guy, I think I was young in my practice, I saw some guy, you could see he was really sick, he was really dizzy, and I wanted to go tell him to stare at the horizon. So I went over to him with the boat, I was like this, and I looked at him, I said, you should really stare. He turned to me, he threw up all over me. That was the rest of it, and I was sick the rest of the trip. We didn't catch anything, that was all I caught. It's a true story. Yes?